Knock, knock. Hello, my name's Abby. I'll be your nurse today. I'm here to do a head-to-toe assessment. Is that okay with you? Sounds good. I'm going to close this curtain to give us some privacy. And can you tell me your name and date of birth? Miss Gracie, do you have any allergies that you know of? Sounds good. Are you okay if we start the assessment now? Perfect. Do you know where you are and about what time it is? You are correct. It is dinner time at home. My patient is ANO times 3. Let's go to skin. Skin appears pink, dry, and intact. No scars, lesions, or tattoos are noted. Skin turgor is within normal limits. Warmth noted. No upper extremity edema is noted. And radial pulses are 2+ bilaterally equal. Capillary refill is less than 3 seconds. Head is normocephalic. Hair is evenly distributed. I'll check for temporal pulses and carotid pulses one at a time. All are present and bilaterally equal. We'll go for sinuses. Let me know if any of this hurts, okay? We'll check frontal first, and then maxillary. No pain? Alrighty. And can you clench your jaw up, open and close a couple times? No popping or clicking noted. No pain. Perfect. No evidence of TMJ. We'll go for lymph nodes. We got preauricular and postauricular, occipital, tonsillar, submandibular, and submental, all non-palpable and non-tender. Perfect. We'll check trachea. Trachea is midline. And one more time, can you just clench your jaw real tight? Cool. Perfect. And we'll tell me where on your face you feel this cotton ball. Alrighty, that'll be at cranial nerve 5, trigeminal, intact. Can you open your eyes real wide? Raise your eyebrows, close your eyes, smile, and puff out your cheeks. Alright, that's cranial nerve 7, facial, intact. Can you say light, tight, dynamite? Okay, that's at cranial nerve 12, hypoglossal, intact. Let's move on to eyes. I'm checking sclera and conjunctiva. Sclera is white, conjunctiva is pink. No jaundice or drainage is noted. Great job. And this is the hard part, but I want you to look at this tree with your eyes, but not your head. One more. Okay, and we'll go in for convergence. Awesome. And then I need you to look at the tree. Look behind me. Look at the treat again. That'll be my accommodation. I'm gonna check with my pen light for direct and consensual pupil constriction. Same on the other side, direct and consensual pupil constriction. There you go. That'll leave me with my eyes perla. Convergence and accommodation is noted, and cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens are all intact. Let's go for ears. I see a beautiful ear shape. Tragus and pinna are mobile and non-tender. And what about nose? Can you close one side? Beautiful. And how about the side? Take a big breath. Perfect. Nares are patent bilaterally. And we're moving on to mouth. Take a look at these teethers. Got great dentition. I see pink, healthy gums, no lesions noted. Can you open up? And I'll use my pen light and my tongue depressor to watch your uvula. Say, ah. Great. Uvula rises with phonation, and that would leave me with cranial nerve 9, glossopharyngeal, intact. Respirations appear even and unlabored. I'm going to go to the posterior side of my patient and assess skin tone. Looks equal with the rest of the body, and I'm going to feel for symmetry, and the thorax appears symmetric. Ideally, I would be listening to breath sounds on skin, but for the purposes of this assessment, we will be leaving the fur in place. I'm going to take the diaphragm of my stethoscope and listen to breath sounds on all 4 levels. So when I place my stethoscope on your skin, can you take a big deep breath? Oh, thank you. Can you take a deep breath in? Ready? Okay, here's 1, and 2, and 3, and 4. Okay, now I'm at the anterior side of my patient, and with the bell of my stethoscope, I'm going to check the carotid for bruits. Hold your breath while I do this, okay? Okay, you can take a breath and hold your breath again. Okay, no bruits noted. I'm gonna go, nope, I need you to stay up. I'm gonna take the diaphragm one more time and listen to breath sounds on the anterior side of the lungs. In the 4 levels again. So we have 1, 2, 3, and 4. Okay, breath sounds are clear in all fields, anterior and posterior. No rhonchi, wheezes, or stridor noted, or crackles. So I'm gonna keep my diaphragm and listen to heart sounds now. We're gonna go aortic, pulmonic, tricuspid, and mitral. Clear S1 and S2 are noted. I'm gonna do the same thing with the bell. And we'll go aortic, pulmonic, tricuspid, and mitral valves. No S3 or S4 are noted. Okay, I've had my patient lay down on her back so I could assess her abdomen. The first thing I'm gonna do is with the light from the room, I'm gonna assess the abdomen for contour and shape. I don't notice any sunkenness or distension. Abdomen appears a healthy shape. Okay, I'm gonna take the diaphragm of my stethoscope and listen to bell sounds. Typically I would do this for about 2 minutes in each quadrant, but for the purposes of this assessment, I will go faster. So I'm gonna take my diaphragm and start in my right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Alrighty, normal active bowel sounds are present in all 4 quadrants. I'm gonna take my bell and listen for bruits. And we're gonna go for the aortic and the renal and iliac arteries. And no bruits are noted. Lastly, I'm going to palpate. Again, we'll 3 areas in each quadrant. So I'm gonna start in the right lower, and then we'll go for right upper, and then we'll go for left upper and left lower. No pain or tenderness to palpation, no lumps or abnormalities noted upon palpation. We'll begin by palpating all of the joints. We'll start with the shoulders and the elbows and the wrists and the hips and the knees and the ankles. Beautiful. No redness, tenderness, swelling, or nodules are noted. I'll have my patient stand up and bend over to touch their toes so I can assess the spine. Spine appears straight. No redness or tenderness noted. No abnormalities noted. And while we're here, we're going to assess range of motion with and without resistance to assess for strength as well. We'll begin with the head and the neck, and then the shoulders and the elbows and the wrists with and without resistance, and the hips and the knees and the ankles with and without resistance. And I'll go back up. Can you shrug your shoulders for me? I'm just checking that cranial nerve 11, spinal accessory, is intact, and it is. I'm gonna go back down to my lower extremities and check for any edema. I see no edema, and I'm going to check for my pulses. I got 2 pulses. We'll do dorsalis pedis and posterior tibial pulses, 2 plus and bilaterally equal, both. And I'm gonna check for my caprifol on 1 toe, and it is less than 3 seconds bilaterally. I'm assessing normal gait, and now heel to toe gait. We're now gonna check the Romberg test. So I'm gonna have you stand up, close your eyes, and I'm gonna count for 10 seconds and watch for any swaying. We got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is a negative Romberg test. I'm gonna check for 1 upper and 1 lower extremity deep tendon reflex. For the upper, I'm gonna choose brachioradialis. Go right there. That's a good reflex. Good job. And a good reflex. And I'll hit the knees for patellar. Great reflex. And knees for patellar. Great reflex. And can you pat your hands really fast? Great job. And that is appropriate cerebellar function. And so I'm going to leave now. That concludes my assessment. I have your call light here. The bed is in the lowest position. All the side rails are up. Do you have any questions? Can I get you anything? Thank you for your participation.